We have a presentation that we'll cover, and then we'll also have it open for questions. We really want to make this meeting as accessible as possible to people who speak other languages. So if you'd like to try the closed captioning in another language, you can right-click on the closed caption box at the bottom of on the bottom right of the screen. A menu will come up, then click on Translate into English. A box will open at the top of your screen where you can choose what language you would like the captioning translated into. And we also have someone here who can help translate questions for Spanish speakers. Before we get started today, we wanted to remind you that this meeting is being recorded and it will be available Friday on the DSPD website under the Individuals and Families tab, and then the Be Informed and Be Involved heading. Please mute yourselves and type any questions into the chat box just to help with feedback. When we're in the Q&A, you can also raise your hands. I'm going to go ahead and give some time to Nadja to translate that.
Hello. Buenos días. Bienvenidos a la reunión familiar y autodefensa. Esta reunión está siendo grabada, así que le pedimos que por favor ponga su micrófono en mudo. La grabación se puede encontrar el próximo viernes en nuestra página del internet y para verla puede ir a dspd.utah.gov, presione Individuals and Families, Resources, and Be Informed and Be Involved. Presione en Family y Self-Advocate Information Gatherings, donde puede encontrar la grabación de la última reunión, así como reuniones pasadas. Estamos haciendo todo lo posible para tener esta presentación en otros idiomas, pero por ahora solo tenemos disponibles los subtítulos. Si desea usarlos en español, puede seguir lo siguiente. Presione en el círculo que tiene los 3 puntitos en la parte de abajo. Presione la cajita que tiene las 2 C mayúsculas. Presione la cajita en la derecha que dice English Caption Settings. Va a salir una caja en el medio de la pantalla. Presione la opción Translated Captions y verifique que se ponga en azul. También presione la cajita, que está debajo y escoge el idioma. En este caso sería Spanish. Presione la X en la esquina de arriba a la derecha y los subtítulos estarán en español cada vez que una persona esté hablando. Si tiene alguna pregunta, la mano derecha, en la parte de abajo hay un cuadrado con líneas, como si fuera que alguien está hablando. Presiónelo y saldrá una segunda pantalla que dice In-Call Messages, en la cual usted puede escribir su pregunta. En la parte de abajo hay una línea que dice Send a Message to Everyone, y ahí usted puede escribir su pregunta. Si la puede escribir en español, yo la puedo traducir. También presione la flecha para que la podamos ver. También puede hacer preguntas en voz alta, solo presione el círculo que tiene en la manito. Le haremos saber cuándo puede hablar. No se olvide de presionar el micrófono para que la podamos escuchar. Si desea mandar sus preguntas por correo electrónico antes de la reunión, puede hacerlo a dspdinfo@utah.gov en español. Estaré presente y disponible durante la presentación en el caso que tengan alguna pregunta. Gracias. Back to you, Angie.
Thank you, Nadja, and thank you for always being willing to help us translate and make sure anyone who has questions in Spanish are able to ask them. I really appreciate your time.
You're welcome.
So I'll just go over our agenda that we'll be going through today. We'll start with announcements, go over some staff changes, give any updates on what we're working on coming out of the legislative session. We'll have person-centered planning training, and then we'll have some training on affordable housing, and then we'll have a presentation from the Human Services Research Institute on a long-term services and supports study that they'll be conducting. And then we'll have it open for Q&A. So our announcements are first, we are sending a survey to people who have recently completed their person-centered support plan meeting. It's a short survey with some questions about your experience with your person-centered planning meeting. Your name is not included on this survey. We're only asking your support coordinator's name. We only share the number of people that responded to each question and the percentage of yes or no's on each answer. We're just really aggregating the data to help strengthen and improve our system. The report of the survey results will go to individuals, families, and support coordinators every year. And we'll also use this to recognize support coordinators who are really doing a great job. We'll also use it to help support coordinators on any areas of training where they need additional information or additional training to make sure that we're staying person focused and person centered in our practices. If we have an email address for you, you'll receive the survey in the email. If not, it'll be mailed to you. And you can help this process by making sure that your email is up to date and your mailing address is up to date during the planning meeting. And if you have questions about the survey, please contact the person-centered planning team. We'll go ahead and put their email in the chat, so you have that. Also, for people in services or who are on the waiting list using one-time funds, who are using the self-administered services model, it is crucial that timesheets are submitted on time and that amount submitted is within the approved budget. Individuals and their families should track their service usage to ensure that they're staying within the approved budget. If additional services are needed to ensure health and safety needs are met, when you have ongoing services, please work with your support coordinator or your case managers to request additional funding before the services are provided. If timesheets for the plan cycle are submitted after the person-centered support plan closes, or if the amount is greater than the approved budget, DSPD cannot guarantee payment for those services. So please just make sure you stay on top of those, get them completed and submitted. I'll go over some staff changes that we've had since the last time we've met. We have Tenzin Soepa. She is with our accounting and budgeting team. So maybe someone that you won't interact with directly as much, but so critical in making sure we're able to process payments and keep services moving along. Adriana Casillas is our new waiver manager for the community supports waiver. She comes to us with years of experience with providers. We're really excited to have her on our team as well. We have Abby Harding is a registered nurse on our physical disabilities waiver. And then Brianna Jones, she's been working in our division. She's moving from the community transitions waiver, which helps people move from ICFs into the community, to be to do support coordination for people who are coming into services through emergency situations through our emergency services team. In these cases, she'll be having someone on her caseload for the first year before they transition to a support coordinator that contracts with us. We're really doing this to try and make sure things go as smoothly as possible. We're able to get things in place, problem solve, and try to get things up and running a little more quickly for people as they're as these are pretty critical situations. Maxie McKay and Sandra Salazar are on our intake waiting list team. And then we have Jan Eliason on our U-Steps team. So that's our case management system. That it's where we have My Steps, our U-Steps for case management, our provider interface. Hayden Johnson has joined our employment planning and inclusion team. And then Philip Redlinger is a program manager in a role that we're using some ARPA funding for. So it's a time limited role, but we're super excited to have him and his experience that he's bringing. He's specifically going to be looking at like how can we strengthen or increase contracts or resources across our state to meet the needs of people, to try and figure out how we can fill some of those needs. We're really excited to have, like, everyone who has joined our team is bringing so many strengths with them. We're really excited to have them. On a sad note, for anyone who knows Jamie Withrich, she was our assistant director. She is now working for the Huntsman Mental Health Institute in their ED. Um, Excellent fit for her. She's amazing, and we're all really happy for her. It is a loss for us, so we will be recruiting for her position. Um, just some updates on our legislative direction that we've used this year. So where we're at on caregiver compensation, um, as you as you may all be aware, it started as a temporary program during the pandemic. And this year, the legislature approved funding so that caregiver compensation can be a service that is ongoing. We're still working on finalizing the plan for how the caregiver compensation will work. Um, we're getting close to having a plan to share with you. So please be watching your email for a draft plan to review, because we'll be gathering feedback on that. Also, many of you may have seen a recent caregiver compensation article that was in KSL. Many people had questions about caregiver comp after viewing this article. If you're currently in services, please reach out to your support coordinator if you have questions about caregiver compensation. And if you're on the waiting list, caregiver compensation is only available to people who are getting certain one-time services. You can contact your waitlist worker if you have questions about this. Next, we have funding for people coming off of the waiting list as well this year. I'm just going to do a quick check to see if Jamie Douglas has been able to make it yet. She is not here, so I'll go ahead and share this. The legislature included $3.6 million in ongoing funds for our fiscal year 2024 budget. So that's July 1st through June 30th of 2020. So July 1st, 2023 through June 30, 2024. And it's ongoing, so people come into services and they are able to remain in services because it's ongoing funding. DSPD, we anticipate bringing we will be bringing people into services throughout the year, not all at once. It'll be about 14 to 21 people who are coming into services each month. Funding will be reviewed throughout the year to make sure we stay within the amount the legislature gave us for waiting list funding. And the first group began receiving services in July of this year. A DSPD transition worker will contact people who will be brought off the waiting list approximately 2 months prior to starting services to begin the process of transitioning. Your transition worker will schedule a meeting date, either in person or virtual, to gather information and start talking about possible services. Families are welcome to start looking into support coordinators and providers on their own, but the transition worker can also help with this. Another update on waiting list services. We currently have 2 waiting list programs that we're working on. The respite only program, it's 8 hours of respite per week for 1 year. This was appropriated during the legislature this year. And we expect to serve around 370 people. The waiting list support team started contacting individuals in June. And then the second program is the American Rescue Plan Act funding. The temporary services include assistive technology, behavior services, transportation services, employment services, caregiver compensation, respite services, and so it's the one-time respite. We'll be able to offer this to around 664 people. DSPD has already started contacting people about this and will continue to reach out throughout August. We'll go ahead and move now to having Timera and Lisa give us a presentation on person-centered planning.
Thank you, Angie, and it's great to spend some time with you all today. Thank you. We'll be spending time in this meeting discussing person-centered planning and what competent or good person-centered planning looks like. We presented the first competency in our last meeting, and today we're going to introduce the next person-centered competency and share a few resources with you. So there are 5 different competencies, and as I said, today we're going to talk about the second one, but these competencies come from a document entitled 5 Competency Domains for Staff Who Facilitate Person-Centered Planning, and it's published by the National Center on Advancing Person-Centered Practices and Systems, or NCAPS. There's a booklet that you can download from their website. They also have a plain language version, which is a little bit more accessible if you're interested in learning more about what all those competencies look like. But quality person-centered planning applies the ideas discussed last quarter about culture, identity, and language, and then we're going to discover existing connections within the community that matter to both the community member and the person with the disability. You'll want to involve the support team in this, which may just be the family and natural supports, to find communities and connections that are meaningful to the person. Person-centered planning tools can help us understand what is valuable to the person so the most appropriate connections can be made, and we'll talk about a few of those today. Quality person-centered planning that cultivates connections first understands the system and supports a person may choose. And those choices can look different depending on the individual and family situation. Those choices could be things like healthcare or social services or recreation, housing, faith, spirituality groups, interest-based community or volunteer organizations, or choices from many, many other options. So are you connecting to the community in ways that are meaningful to you? Or are you supporting the development of relationships that matter? This particular competency for person-centered planning encourages us to look beyond segregated activities designed only for people with disabilities and find ways to build friendships and meaningful connections outside that paid service system. Being person-centered means that you support the person or that you yourself are being supported in relationships that matter. And it means working with your team to execute the person-centered plan that you want. Person-centered planning focuses on that universally valued goal of living a good life as designed or defined by the person. All activities focus on you as a whole and not just a diagnosis or the disability. It means ensuring activities, skill building, decisions, and planning is meaningful to you. So now I want to share some tools that will help you make those important community connections. The first tool I want to share with you is the Integrated Support Star. And there will be a link to the star put in the chat for you so you could access it. There are 5 different sections to the star. The top is personal strengths and assets, and it's teal, and that could include things that you own or things that you're good at, things that you like to do. Relationships is that purple section, and those are people that are important to you, your family, your friends, community members, school members. Those are all your relationships. The third section is eligibility specific or paid support section, and that's in green. So that can include things like your Medicaid waivers, Social Security, housing vouchers, which we're going to talk about in a minute, and other things like that. Community-based supports are in blue, and those are items that anyone can access. That could be schools, parks, recreation centers, libraries, but things that are in the community that everyone can access. And last, we have technology in that kind of pinkish red section. And that's everything from high-tech items to low-tech task lists or schedule boards. But you can put all those in that particular area of the star. So each section represents a type of support a person may already have in place or that they may need for the future. We've done a webinar on how to fill out the star, and it's on our Person-Centered Planning webpage, and it's under the Tools to Plan Support webinar series. So a link will be put in the chat for that particular web page. Another helpful tool for making connections is the relationship map. On one page, you can show your community connections as well as paid, unpaid, or natural supports. And again, a link will be put into a chat for a fillable PDF version of this particular tool. The relationship map assists the person with identifying the people in his or her circle. And you can also see where you're lacking connections, where you need to work on it. The 4 different areas are family members involved in my life, people and organizations that support me at home, friends, and people and organizations that support me at work, school, or in training. And the Tools to Plan Support webinar series also has instructions on how to fill out this tool, but it's so easy. All you do is write names of people in the different boxes where they apply. And the closer you are to the sender or to the person is how close that relationship is. So again, you can look at it and see, oh, I'm really lacking here. I need to build up supports here, or I've got a lot of great connections here. So it's a great way to understand where you need to make some more connections. And now I'm going to turn the time over to Tamara Blackwater to share another resource with you.
Thank you, Lisa. Hello, everyone. I want to introduce a new resource called the Community Integration Strategies and Recommendations. We will put the link to the document in chat, and so open up that link and we will go into more detail of the document in the next few slides. This resource consists of 5 community integration activities to guide support team members, advocates, and our professionals like direct support staff, job coaches, and educators to support people with disabilities to meaningfully connect with their communities. Next slide. So let's take a closer look at the community integration document. It begins with a brief introduction of the document to support team members, advocates, and other professionals who are supporting a person with disability and connecting them to the community. So a definition list was created to provide context and common language for anyone who may not be familiar with community integration. The definition list includes words like community, natural supports, and informed choice. We also included a section called Tips for Facilitators. A facilitator is a person who is responsible for leading a discussion or activity. For example, a direct support staff is a facilitator in developing a community map with the individual and their family. These tips reinforce inclusion and full acceptance of the person as you're supporting them to meaningfully connect and engage with their community. And then finally, we get to the 5 community integration activities. Each activity provides potential roadblocks to community integration, offers recommendations and ideas, and then a thought exercise for the facilitator at the end of each activity. For the purpose of this presentation, we'll focus on activity 5, connecting to the community. Next slide. So all these previous activities builds towards activity 5. In this activity, it provides strategies of how to support the person to be included and involved in their community. One strategy here is support the development of community connection. And how do we do that? We plan from the perspective of the person's culture, value, preference, and interest. So don't assume you already know what connection or resources the person or family needs. So I hope this new resource will be helpful to you and your team in building connection between the people using services and their community. We encourage you to use the community integration strategies, the integrated support star, and relationship map to help you make those connections. Please reach out to our team, the community employment planning inclusion team, for any questions. The email will be put in the chat. And thank you for giving us this time to present and pass on to the next presenter.
Hello, all. Oh, sorry, Angie.
Oh, you're good. I was just going to introduce you. Feel free to jump in and introduce yourself.
I am Mandy Cecita, and I am part of the housing team. I'll be presenting today on affordable housing resources with Camille Bowen. Next slide. So what is integrated housing? Integrated housing is housing in which a person with a disability resides or can reside inside the community. So it would be such as an apartment building where there are units that people with disabilities live in, but then there are also units that are for the general population. Next slide. Why affordable housing and services are important. They provide options and individual choice. It improves their health. It allows for independence, stability, and security. It is fairness and equality and equity, and compliance with the settings rule and our strategic plan. Next slide. So research shows that combining affordable housing with intensive services for any high needs groups saved an average of over $6,000 a year per person in healthcare. On average, people offered supportive housing spent 23% fewer days in the hospital, had 33% fewer emergency room visits, and spent 42% fewer days in nursing homes. Next slide. Affordable housing programs vary by public housing authority. So there are several options. One is a housing choice voucher, also previously known as a Section 8 voucher, where the resident picks where they want to live, and it is portable, so it can move around with them if they choose to move. There's also project-based vouchers, which is a rental subsidy, and it's attached to the unit. So if they leave that unit, they do not get to take that with them. It stays there at the unit. And then there's mainstream non-elderly disabled vouchers, which a family that includes at least one person with a disability between the ages of 18 and 61. These vouchers operate the same as a housing choice voucher, so they are portable. And then there's public housing. They provide decent and safe rental housing for eligible low-income families, elderly, and persons with disabilities. So public housing usually is managed by the housing authority. And it does not operate as a voucher. So it is an apartment complex or a unit that has a subsidy attached to it. Next slide, please. Housing choice voucher program. I went over, oh no, I didn't go over any of this. I apologize. So the vouchers reduce the number of families living in crowded housing by half. They also reduced homelessness by 3/4. And they reduced the number of moves over a 5-year period by more than 1/3. Next slide. So keys to success. Learning housing terms, programs, and processes. And you can do this by visiting the Public Housing Authority's websites. Communication. So ask questions, follow through. Sometimes when you're contacting housing agencies or public housing authorities, it's not always immediate, the responses that you get. So you do need to follow through. Updating your information with housing agencies and properties, such as your mailing address, email, phone number. They usually will contact you by mail. So you want to make sure that your address is 100% up to date on there. And you can do that by updating your wait list status on there, your form on there. Your reasonable accommodations are special housing types and you can use them in shared housing, not a group home. And reasonable accommodations are anything that's going to help somebody live independently in the community. Supportive services. Housing choice vouchers can allow, through a reasonable accommodation, a live-in aid of the participant's choice, or the ability to rent from family due to a person's disability. A person may receive supports and rental subsidy. Next slide. And then I'm going to actually give the time to Camille for this one. Thank you.
Thanks, Mandy. Hello, everyone. It's great to be here, part of the housing team. My name is Camille Bowen. Just to give you a brief explanation on what the housing team, what Mandy and I do, We assist individuals and families that come to us through a referral through DSPD waitlists that could be going through intake or are in services and are interested in finding affordable housing out in the community. We conduct needs assessments for those that are referred to us. And we identify people and what their needs are, what available housing there is, and what programs are available that fit those needs in the community, and that enable individuals to make choices in housing or to make long-term goals. Sometimes waiting for a housing choice voucher could be a year or more, right? Depending on the area and what housing authority you're applying at. But so it's also good to have as a long-term goal. Even if you can't live in an individual apartment, or you change and you feel like you can later on, and that's something you want to make a goal to do, then that's something to talk with your support coordinator and discuss and make that a long-term goal on your PCSP. And then also we would like to discuss human rights, fair housing, responsibilities as tenants, and recommend resources to assist with landlord-tenant mediation if you're having any issues with your landlord. That is what the housing team does. And the next slide will show you our contact information. If you have any other questions, please reach out to us. We'd be happy to answer any of your housing questions or needs. Have a great day. Thanks, everyone.
Thank you, Mandy and Camille. And really thanks so much for all of the work that you do to help people like find housing solutions, resolve barriers. You really make a big difference for people. So thank you for your great work. I think we have Sashka online to present on the long-term services and support study. It looks like Jasmine Hepburn is also online, so I'll give some time over to you.
Great. Thank you, Angie. And I think Jasmine is going to bring up the presentation here in a couple of seconds. So while we do that, I would like to introduce myself to everyone. My name is Sashka, and I work for the Human Services Research Institute, which recently won a contract with the Utah Department of Health and Human Services to conduct a research project on long-term services and supports in the state and provide recommendations to improve the current service system. And when we say long-term services and supports, or we use the acronym LTSS, we are talking about services that help people with disabilities and older adults live their everyday lives in their communities, such as home and community-based services, which are provided to youth specifically through DSPD, but we'll also be talking a little bit about the services provided through aging and adult services, and then also Medicaid. So let's go to the next slide. So over the next 15 or so minutes, hopefully, we'll stay on time. We are going to talk about who HSRI, Human Services Research Institute, is, provide you with some more information about the project and what we are looking to do, and then also hopefully get some of your initial feedback on the priorities and the most important things for us to focus on during the course of this project, and then talk about next steps and what we plan to do from this point on. So we want to introduce you to our team. So the Human Services Research Institute, or HSRI as we call it, is a national nonprofit which was founded in 1976 to improve the availability and quality of supports for children and adults with disabilities and other vulnerable populations. And the belief that drives all of the work that we do is that all people and their families have the right to live, love, work, play, and pursue their life aspirations in their community. And if you're curious about some of the other work projects that we've done across states, we encourage you to check out our website, which is www.hsri.org. And we can probably, Jasmine's got that link in the chat. Thank you so much. Let's head over to the next slide. So we have a number of team members that will be working on this project, but they couldn't all be here today. So the three of us that are on the call include our project director, which is Jamie Petner-Array, who is based out of New Mexico. She will be here during the afternoon session. She couldn't make it for this morning session. And then I will be the engagement coordinator for this project, and I am based out of Utah, have worked within the disability network here in the state for a number of years. So I have familiarity with the system, and like all of us, have a vested interest in doing what we can to make the system the best that it can be. And I will let Jasmine introduce herself.
Hi, everybody. My name is Jasmine Hepburn. I'm based out of Washington State, but I did actually live in Utah as a child for a little while. So I'm very excited to be a part of this project. I am our project coordinator. My information is here. It'll also be at the end. If you ever have any questions about the project, I encourage you to reach out, and I'm happy to answer any questions or connect you with somebody who can answer questions.
Thank you, Jasmine. Let's head on over. Thank you. So we are not going to be doing this project alone. We are working alongside the Utah DHHS, not just DSPD, as I mentioned, but Medicaid and Aging and Adult Services. And then we're also going to be coordinating with the Utah State University Institute for Disability Research, Policy, and Practice, and then also a national organization, Burns and Associates, specifically on some of the work around provider rate studies. Okay, so now that you have a sense of who we are, we want to talk to you about what this project is, what it's going to look like, entail. And so the purpose of this project is to learn from you all. So people in services, family members, providers, advocacy organizations, and other community members, anyone who is connected to the Aging and Disability Network in the state, about what is currently going well and not going well in the service system. And we plan to get this feedback through one-on-one interviews and focus groups, which we will talk about in this presentation. We're then going to use that feedback that's provided to us and help use that to structure a set of recommendations for the Utah DHHS about how to best meet people's needs using a person-centered approach, how to best structure or organize services, provide ideas for how to create greater capacity to serve more people within the system, and also how to expand individual choice. So a few priority areas that we have identified for our recommendations include people being a part of their communities, supporting people and families to live where they want. So that could mean with family, in their own home or apartment. Connected to that, the ability for people to receive services in their own homes and communities instead of institutions. Improving opportunities for competitive integrated employment, or CIE. And that term, if you're not familiar with it, means that people work in jobs that are open to everyone in the community. They're paid at least a minimum wage or at a rate comparable to coworkers that do the same type of work. Another priority is using a person-centered approach to support people in having choices about what services they receive, who provides those services to them, their staff, who they live with, and all of the other choices that we all make on a daily basis. And then figuring out how to help resolve some of the direct care staff workforce shortages and creating more capacity within the system to, again, serve more people, and also to make sure that the services that people are currently receiving are high quality. Expanding home and community-based services, including looking into what are the ways that we can eliminate sort of an all or nothing model where people either have access to all services or they are on a waiting list and have access to no services. Expanding the network of people who provide services and looking into different ways of how services could be provided or structured. And then making sure that people who live in rural areas have the same type of access to services as people who live in more urban areas. And finally, ensuring that resources are equitably dispersed and there is equity in terms of how much services people receive and also how much providers are paid for different services. And you may have other priorities for the service system, and we'll definitely want to hear from you about that. And we'll talk about an opportunity to do so in the next slide or two here. So to help develop the recommendations around the priorities we just shared, we are going to be working with a committee made up of representatives from the Disability and Aging Network in Utah to help us come up with goals and plans. And we are also going to conduct research on a number of topics related to the service system and also identify some best practices from other states around long-term service and support systems. And then we're going to do a needs analysis, so estimating what the need for services is going to look like in the next 20 years. And as I've mentioned, we're going to be doing one-on-one interviews and focus groups with people in services and families. And we are not able to provide all of the details just yet about when those are coming up, but please know that they will be paid opportunities. So you will be paid for your time if you would like to participate, just because we know it takes time out of your day, but we also want to make sure that you are able to participate and provide feedback. So all of that being said, if you are open to it, we would like to get your feedback on the priorities for the service system that we identified today. So we'll go to the next slide, which has a QR code that you can scan for a brief feedback form. There's also a link if you want to type that in, and Jasmine just put that in chat as well. This form is divided into two sections. The first section asks you, what is your top priority for the Utah long-term service and support system? If you could make one thing better about the service system, what would that be? And about any questions or feedback that you want to share about this project with us. And you don't have to answer all of those questions. So if you want to answer one, but not the other, that's okay. If you want to, she's saying, not right now, Sashka, I'll come back to this form. That's okay as well. We're just looking to get some initial ideas from you. And if the form is not the type of format that works best for you, we'd also encourage any responses that you may want to share with us in chat as well, or reaching out to Jasmine, and we'll provide Jasmine's email to you as well. And then, so once you click next at the bottom of the form, after you look at section 1, you will be taken to section 2. And this section is completely optional if you would be interested in participating in those paid one-on-one interviews or focus groups for this project. We're just asking that you provide your contact information and fill out a couple of different questions so that we can get in touch with you when those opportunities open up. And then you can scroll to the bottom and click submit. And if you're not interested in participating in the interviews or focus groups, that's completely fine. You can just scroll down to the bottom of section 2 and click submit. All right, so let's go ahead and go to the next slide and talk about next steps for this project. We are still in the very early phases of this project. We just started last month, and this work will continue through 2025, so we do have some time. But one of the next things that we are planning to do is to have our first committee meeting. We're going to begin conducting the focus groups and interviews, and we still need to finalize our full work plan. And then we are going to begin our research so that we can develop recommendations for the state. So I know that I threw a lot of information at you very quickly. So if you do have any questions, please feel free to reach out to Jasmine. Her email address is jhepburn@hsri.org. And we can also go ahead and put that in the chat for you. But we're really excited to get started on this project, and we want to thank DHHS for giving us the time to speak with you all today about it, and hopefully getting your feedback so we can develop a strong set of recommendations to really improve and support the service system in the state. So thank you, and we're happy to take any questions as well.
Thank you, Sashka and Jasmine. We're really excited to have you working on this study too. We definitely feel there's a need for it, and we're excited to have your engagement and have people giving you feedback. We're moving to, and I guess one thing I did want to throw out there for everyone to know is we know and love Sashka. She worked at DSPD. She was exceptional. We were sad when she went to HSRI, but we do think she is such an asset there and love that she's there too. So she definitely has worked with people in our field, really relates to our service system, and she really is such an asset. It's going to be really excellent working with the HSRI and Sashka and Jasmine. So we'll go to our, you're well, yeah, of course. We had some questions submitted before we started, so I'll go ahead and start with those questions, and then we'll start getting to the ones that have been asked during the meeting today. The first one is, what do we do if we had the SSI phone conversation in early June and haven't heard anything back yet? So Social Security falls outside of DSPD's scope. Please contact the Social Security Administration. The next question is, we have been on the wait list since our daughter was 4 years old. She is now 18, and we haven't received any assistance except 1 week of respite care 1 year. There are some educational programs we would love for her to participate in that we cannot afford. What is our outlook? Please contact your waitlist worker who can talk to you about what might be available. And if you don't know who your waitlist worker is, please call our intake line at 1-844-275-3773, and we'll put that in the chat as well. The next question is, we are going to be moving to Idaho in 4 years. Will we have to start all over again with DSPD waiting, or is there a way to expedite the process? So each state has its own program. You'll need to contact the state of Idaho for details about what you may qualify for and what their intake process is. So a question that came in today is, Angela, the 2 waitlist programs, respite only and ARPA funding, what are their funding caps and time limits? Are they just for the 2024 fiscal year? How much funding is available to the families on the waiting list? I think we have Jamie Withrich online now, and I'm going to go ahead and let her answer that.
Hello, I'm having some network issues.
Oh, I'm sorry, Jamie Douglas. I just called you the wrong person. We have Jamie Douglas online.
That's a good person to be compared to, so not an issue. My camera is not working momentarily due to network issues, so I apologize. So the respite only funding, we've got $3 million to serve about 370 people. That program started July 1st and will go through June 30th of 2024, or until the person uses all of the available funding. Individuals will have $8,000 to use for this program. And ARPA, we've received enough funding to serve about 664 individuals this year from August through June of 2024. Individuals will have $10,000 for this program. And then we do have 1 more year of ARPA funds that will start in July of 2024 and go until June of 2025. And that will be 664 people as well.
Thank you, Jamie. The next question is, will this information be available after this meeting, email or so? Yes, we post the meeting recording, the slides, and the list of links that are shared in the chat on our website by the end of the week. And we'll go ahead and put a link in there that will take you to the area that this will be posted. There's a question for Sashka. For this study, are group homes, foster agencies part of this? I have had very bad experiences with some agencies using respite.
A very good question. I think we'll have to take that back to our team and verify exactly all of the different settings that we are looking to conduct this study on, but we will take that feedback into account.
Thank you. Our next question. Hi there. I am new to the DSPD program. I am still learning, but also very confused. I tried to contact the intake officer, but not much luck. Is there any contact point that I can go to for more information? So we had shared the intake line. So if you're not able to get a hold of your direct waitlist worker, the intake line is 1-844-275-3773. I don't know, Jamie, if you have any other recommendations.
That's probably the fastest way to get questions answered. There should be 2 people on that can answer anything that you have questions about. I don't know if there's anything more specific you want to add to that question so we can answer it a little bit better.
Thanks, Jamie. Those are all of the questions we have, but I'll go ahead and wait a few minutes in case people are kind of thinking through what they want to ask. So I'll give you a few minutes. It looks like we have some questions coming in. Let's see. The first one is, can you tell us a few options for services while we are on the wait list? I do think that is a challenge. One of the things that we do have going on right now is the Utah Developmental Disabilities Council is doing a pilot with the Utah Parent Center for a small number of people while they're on the waiting list to do more kind of like exactly what you're asking, finding out what those resources are. And we do anticipate at the end of that to like have a little bit more robust list of resources. It definitely is a challenge. We do have, as we talked about, some of those time limited one-time services available. Again, it does not reach every single person on the waiting list. Jamie Douglas, do you have any other thoughts or ideas to add to that?
No, that's about it. I mean, we have different programs. We really do try to pick criteria so that we can reach as many people as possible with all the programs that we do have, but it's just based on available funding.
Thank you, Jamie. And I would just add, the Utah Parent Center is a great resource. It is all families with lived experience who work there. And they're great at like problem solving as well. So they're a great resource to call. The next question is, can you tell us a few, oh, sorry, that's the one we just did. I'm so sorry, I just got on. Were we told how caregiver compensation is going to move forward? We are finalizing that right now, and we will be sending it out. And when we do, just be watching your email. You'll be getting an email with what this would look like moving forward. The waiver amendments are out for public comment right now. They don't have as many details about what it would look like. We have taken a lot of feedback from families and from contractors about what they're what they need and what they're hoping it could look like as we've been processing this. So we really look forward to sharing it, and you should be getting it pretty soon. Hey, I think if we have Kristen on, the next question is for her. What rubric is the RFS committee using for approving SL3?
That's a great question. So they are looking at the overall picture right now, currently, until the plan moves into the ongoing one. But right now, they're looking at the overall picture of what an individual is receiving in their budgets and making sure that the caregiver compensation fits the criteria for supported living and that it matches the needs of that individual. So there's not like a set criteria besides the criteria for supported living. So if you were interested in that, we could give you what the criteria for that is. But in general, they're just looking to make sure that the individual needs supported living and that what is being awarded matches that need.
Thank you, Kristen. The next question is for Camille or Mandy. Are any of the housing vouchers available to families housing their adult children with disabilities?
I will take this. There are, you just need to contact the housing agency in the area that you want to get them on the wait list. The thing is housing agencies have special programs like the non-elderly disabled vouchers that we spoke of, that when they are pulling, when they're allowed and they have enough budget to pull from their wait list, they fill those special programs first. So the wait list is not going to be as long for those special programs as it would be for a housing choice voucher. So yes, get on the wait list. I can't tell you how long of a wait that will be. Most housing agencies will not either. But I have been told that they are, when they are pulling, they are moving faster than the housing choice vouchers. So if you have adult children that are under the ages of 21, get them on that non-elderly disabled voucher list. And if this is for Salt Lake County, depending on what area you're referring to, all 3 housing agencies are open to apply at this time. I hope that answers your question.
Thank you, Camille. We had a question that said, cannot find any info on those waiver public comment links. Joseph Ambernack, he's with Medicaid. He put a link in the chat, so hopefully you can see that. We can put it in again right now to just make sure you see it, because I think we have another question that says, where do we find waiver amendments for caregiver compensation? You mentioned they're out for public comment currently. They are, and that is, that's the link that Joseph put in, and I'll just go ahead and put it in there again so that it's.
Can I add an additional comment if that's okay, Angie?
Please do.
Okay. And I think I just want to be, or to set expectations as well for the group, that the language that is in the waivers is fairly technical. It does not necessarily talk about the processes that DSPD will use, nor the reimbursement that will be involved. It more describes how we're going to consider the authorization of services. So CMS does have a concept of what's called extraordinary care, which requires the state to acknowledge that for age appropriate care, that can't be compensated by the waiver program or the normal pieces that a parent or spouse may do in the care of a family member. What we are required to describe is what criteria we are using to define that extraordinary care, how we go through the authorization process to make sure it is in the best interest of the individual, and the authorization of caregiver compensation in and of itself doesn't create a health and safety concern, either for the waiver participant or potentially the family member if they may be overextending themselves, perhaps physically or emotionally. So it is very high level information in those documents. You of course are welcome to submit comment there, but the other processes that Angie mentioned, DSPD will be sending out at a later date, that kind of go into the inner workings of how the assessment will work, how the hours and funds are authorized. That's probably going to be more of interest to the majority of individuals.
Thanks for clarifying that, Joseph. I agree.
You're muted, Angie.
Thank you. I'm not seeing any additional questions or any hands raised. Except for it looks like maybe we have a question that just came in. It says, thanks. I am not sure about how the Medicaid and Social Securities for disabled people work. My son is only 16, but I was advised I should start applying now. Sorry, I think you missed my question. I think I must have. So for Social Security, you would definitely want to reach out to them to determine when the right time to apply is. And Joseph, would you mind speaking to like applying for Medicaid?
Apologies, I didn't quite catch all of that.
Let me read it again. It says, I am not sure about how the Medicaid and Social Securities for people with
Yeah.
disabled people work. My son is only 16, but I was advised I should start applying now.
And I think there may be two pieces there. And unfortunately, and I apologize because I know it is confusing when working with multiple state and federal agencies. But for Social Security, it may be important to apply with them specifically for disability for your son. Because there may be a potential income receipt that could be possible there. It also may assist as well with the determination at the Department of Workforce Services that manages Utah Medicaid eligibility. The programs do use very similar rules. So if you are qualified for one, you are more than likely qualified for the other. But there is a disability determination that may be required with our partners at Workforce Services. The best routes to start are really off of the Social Security website or at jobs.utah.gov for the Medicaid application. And there are some resources to get started, either online there. Yeah, there's a lot there. I will leave my email for you in chat as well. And please feel free to reach out to me. I think there's you might be at the start of a fairly lengthy process with both entities to begin work there.
Thank you, Joseph. The next comment, I think, is probably for Jasmine and Sashka. It states, I'd like to suggest to have more strict guidelines with foster agencies and group homes. A lot of them bypass policies, misuse client funding, and I've seen clients treated unfairly. Staff are not properly trained from my experience.
Thank you for that comment. What we have done is we have collected it. So Jasmine has collected that to include in sort of the data collection pieces on the survey. And we will certainly review any comments on the survey or any additional priorities that you have for us in chat. So appreciate that comment.
Great. And then our next question is, I think this one is for you, Jamie Douglas. I have been on the wait list for respite care for my daughter, my adult daughter. Is there someone specific I could contact about that?
Yeah, you can contact your waitlist worker and have a discussion. If you don't know who that is, you can call the intake line and they can get you connected.
Thank you. Next we have, thank you. Group homes and parents providing SL3 are very different. Will they be treated as such? And I think, again, Sashka and Jasmine, I think this is probably for you.
Yeah, I know that we will definitely need to take into consideration the different settings that we are looking at as to where services are provided during the course of the research project. So again, this is a comment that we're going to go ahead and collect. And if you have any additional feedback, please put that on the form that we provided the link to today. And if you are interested in really parsing this out with us, I'd encourage you to also sign up to participate in an interview or focus group if you are able to. But we are collecting all of this data right now.
Thanks. We had a follow-up question. What is SL3? So that is a supported living code specifically that identifies that it is a caregiver. So a parent, guardian. So that's what SL3 is. Our next question. Okay, Sashka, I'm just going to actually jump to this question because I think it's a follow-up to yours. It says interview how?
Yes. So Jasmine has just put in the form that we shared today for this research project where you can sign up to be a part of an interview or a focus group. We're thinking they could be virtual, they could be in person, whatever is your preferred preference, over the phone, whatever it may be. And so if you want to just provide your information on that form, that would probably be the easiest, or you could also reach out directly to Jasmine, and Jasmine can put her email in the chat and we can connect with you at a later time. So thank you for that question.
Thank you. Okay, we have a question that is, because we use Give Care instead of a fiscal agent, so that's someone using a provider versus self-administered services, we are having taxes taken out for our caregiver compensation. As long as we file it on the right place on our tax return, should we get all of that back? That is really a question you have to take up with your tax advisor. We definitely are not a tax advising agency, so please follow up with your tax advisor on that. Okay, not seeing any hands raised or any additional questions. We can wrap up today. I will let you answer each other's questions if someone has a recommendation for her on a good tax advisor. Our next family gathering, I did want to mention we have our Disability Advisory Council Tuesday, August 22nd. It's our public input meeting, so please come and participate if you're interested in that. And I just want to say thank you all for coming and for participating in the meeting today. Thank you to our presenters for the information you've shared. And I hope you have a great day and a great week. And we'll see you later. Thank you. Bye.